But I'm making you a host now.
Okay, I'll share my file. Or too early to share, right? Or should I share now?
Just prepare your slides if you can.
Okay.
Yeah. Very clear.
Okay.
Let's wait for these people come in. We got 7 people now.
My slide now moving, Ryan.
How's your volume?
The volume okay now?
Okay, okay.
Okay. Good morning, Kumaran.
Morning, man. I'm driving now.
Kumaran, driving?
Uh,
Oh, okay.
On the move, eh? I hope Dr. John can join us from US.
Sorry?
I hope Dr. John can join us from US.
Oh, okay.
He's fired up, bro. He's already our mobile stockist in the US now, under your line.
Great, bro. Great.
He's expanding to Cameroon.
Wow.
Okay, Pat. So I think we're gonna start because I'm also having this recorded. So for the benefit of those people who couldn't attend, so I have this recorded, so we can actually start now, right? Okay. Good morning, everyone. Good evening to the rest of you who are in the US or other parts of the world. Thank you for joining us in this Zoom today. Yeah, today we have a special speaker, a special guest speaker, Madam Patricia, who used to be in the medical practice. She was in a registered nurse before. Okay, today she's with us. She's gonna share with us her experience and share with us about the products as well on AFC. Okay, so without further ado, let me welcome Patricia.
Okay, thank you, Alfred. Good morning to everybody. So this is what Alfred said. I'm sharing my experience of wellness and what I have been like having a community of wellness community and how we have approached health. And today we're going to look at how we can empower our health further with AFC Life Science products. You know, we're looking at a holistic approach to wellness. Can you hear me well? Okay, living our best life. So I always say living our best life, how we can maximize health span and the science of aging well, you know. So when we look at the aging process, we have to look at 2 things. One is the lifespan, which is the total number of years that we live. But more importantly, I feel is the health span, is how many of those years we remain healthy and free from disease. So when I look around me, there are a lot of my friends, family and all that, they got members of the family who become sick and they're really very difficult to manage and very costly, and it's very heart-wrenching to see people suffering and not getting better, and then they succumb. So they are suffering before they pass away. Passing away is a normal process, but do we need to be sick before we pass away? Do we need to be incapacitated and be bedridden and causing burden to others? So we're going to look at that and how we can minimize that. Okay, when we look at balance between optimal health, there are 2 things that are actually happening in our body, which is entropy and renewal. Entropy means degeneration and renewal means regeneration. So that is how our body has been working all the time, because when we are born, we kept on regenerating from, as you remember, from very 2 cells, we regenerated until we become a human being in many systems and all work properly. So you see, when we have entropy in our body, we have a tendency for the body to break down because of how the environment is and the normal process of life. Every day our cells break down. Okay, but we also have the ability to rebuild and renew that, provided we support the body with the right nutrition, lifestyle and things. Is that an echo? Entropy means is a measure of chaos in a closed system, disorder in a closed system. So our body is a closed system, so we really don't know what's happening inside. But when we talk about regeneration, generally refers to renewal. In biology, it means the growth of new cells, new tissues of a part or damaged organ, and to renew it to its full capacity. We can do that if we support our body in the right way. We can renew and we can repair our body. Okay. When we look at degenerative diseases, it is a disease of deterioration, not caused by an adverse event. What I mean by this is that the chronic health issue or non-communicable diseases are caused by body deterioration, not because it's been, you got an infection or you got an injury. It's because our body is deteriorating. So what is the cause for this? When we look at it, long-term lack of maintenance of the body. We don't maintain our body, but we maintain our house, we maintain our car. We don't have a system where we actually have a regular maintenance. We go for a medical checkup, but that is not actually looking at our internal side or whatever. We just go for blood tests and we come out, or some tests and we come out. And then nutrition. We are also aware of nutrition, but we're not so aware of the micronutrients, which is more important, like the minerals, the vitamins, the phytochemicals and all that, which aid in our enzymatic exchange and all that. Alfred, why am I having such an echo? Protection.
I think one of the participants did not mute.
Can
Mr.
you mute
Koo,
them, please?
Mr. Koo, I think your can you mute your mic, please? It's causing disturbance, echo. Thank you.
Okay. Then we have to protect ourselves from free radicals, which we can't run away from, because everyday life we are exposed to free radicals. And because of the lifestyle that we are having, the food choices we are making, we are having chronic inflammation and oxidative stress in the body. So all this causes our body to deteriorate as days go by. So we see when we have imbalance occurs, we get signs. How it happens is that we feel low energy, we feel fatigued, very tired, we have poor digestion, we gain weight excessively, we are foggy in our thinking, not only foggy, but we get triggered very easily, we get upset very easily, we are like in a breaking point. Then we have aches and pains all over the body, we accept that as normal process. And then we go into major chronic health diseases, health issues, chronic diseases. So we're going to see what are the phases of aging. Actually, when you break down the aging process, we first start off by the age of 25. We go into a subclinical phase of aging, where free radical damage has already begun, but we don't have outward symptoms present. And then when we go for lab tests at 25, we don't have any diagnostic equipment that is sensitive enough to show the changes at that time. So we are still young, and we can compensate for the next 10 years. We carry on until age 35, then we go into a transitional phase of aging, where a good portion of the cellular protein is already damaged by oxidative stress, pollution, and the chemicals that we have around, and our bad food habits and our poor lifestyle. We don't sleep enough even. So then we have significantly entrenched mutational changes that leads to cancer, degenerative diseases already present at 35. But symptoms such as glucose intolerance is already present. Some people have high blood pressure, hypertension, and digestive system dysfunction. Then the body is actually starting to decompensate. When you go for lab tests at this first age 35, it may show borderline. But actually, we are really entering into a transitional phase of aging, which we don't realize. Then we see many of us may or may not have outward signs. And then we also put it down to that's a normal process, and we go on for the next 10 years, where we go into age about 45, That's where we go into a clinical phase of aging. And then a variety of outward symptoms commonly we take it as a normal consequence of aging. For example, when we have poor memory, we say, oh, I'm getting old, give an excuse. Then we have low energy, we say we are getting old. And then hair loss, then we have wrinkles, and then lack of libido. A lot of the things that we used to do, we are not able to do. So we just put it down to aging process, but it is not necessarily so. Then lab test shows abnormal values. Then clinically active degenerative diseases may already be present. At 45, people are already starting having strokes, heart attacks, cancer, and maybe combination of all that. Nowadays, a lot of also joint disintegration like osteoarthritis and all these problems. So the mobility is also affected by 45. But we need to take a proactive approach to changing this. But at 45, when you talk to people about health and wellness and all that, they are more into taking care of the family, the responsibility and all that. So health becomes the least priority. So this goes on for the next 10 years, and then you come into a disease manifestation age when you're 55 years old, and very few people can escape a body free of atherosclerosis, that is actually plaque in the arteries, fat deposits, or arteriosclerosis, which is hardening of the artery, diabetes, cancer, and maybe all of this combination they might have, which accounts for 80% of age-related diseases. When people are sick at 55 or not well at 55, it's always related to one of the degenerative diseases. And most people are on some drugs to treat the symptomatic treatment only for of the disease, but they don't take care of how we can actually change and reverse whatever has happened, because we are going to go through the normal process where we go to see the doctor, and then the doctor puts us on more chemicals, and then they give us all kinds of advice which doesn't help our body to regenerate. So if we don't do anything with that, so what happens is we end up with more chemicals and more degeneration. I'm sure you must have heard of your friends who are diagnosed with the whatever degenerative disease, for example, of diabetes, and then they're on one medication, then on two medication, and then they're on insulin, then they have a kidney issue, they have an eye issue, they have a nerve issue, and in the end, they are so incapacitated. So this is what is happening, which we don't realize. So the next one is why? Because we know the trends in medical advancement is there. We are aware of micronutrient awareness. We know that vitamins are sold everywhere. Even the clinics, the pharmacies, the doctors advise you, even a lot of networking companies sell micronutrients, and we do buy. It's a very big market out there. Then we also have more hospitals, and which is more sophisticated hospitals that look like very grand 5-star hotels, especially the private hotels, private hospitals. And we have more sophisticated procedures. The doctors can do so many procedures, head to toe, they can do procedure. And then we have sophisticated drugs. Many new drugs have come up, but only it actually doesn't do much. It actually blocks one system and takes care of another system, and you don't know how much of side effects it has on you. And also we have more specialists. From head to toe, we have specialists, But what is happening to our health? If all these things are working, this advancement in medical advancements are working, we should be a healthier lot. But we can ask ourselves, are we getting healthy day by day, or are we becoming more diseased? So you see, when we look at it, basically we need to look at our diet, how we eat and how our lifestyle. So if we have a diet that is high on inflammatory foods, we end up having all these issues like fatty liver, and then immune disorders, we have cancer, and we accelerate our aging process. And so what happens is when we are in that kind of a state, we pass that kind of epigenetics to our next generation. Whereas if you're on a healthier side, where we're eating food, whole foods, more plant-based and lean type, not obese, you got more muscles, we are actually passing on better epigenetics to our next generation. So this is what's happening. We can see younger children are getting sick now. You can see children at the age of 12 or 13 having chronic major health issues actually. So this one is from generation to generation, but we can do something to change that actually. So when we look at it here, this actually, you see the first part here is the inflamed tissue. When we are obese, we have inflamed adipose tissue, and then what it sends out is pro-inflammatory cytokines. That means messages that sending inflammation. causes our body. That's our body's reaction. Because when we have overloading of chemicals in our body, we actually take it as an injury to the body. We react by inflammation. So what happens? We start having insulin resistance, cardiovascular diseases, we lose muscle mass, kidney issue, neurodegenerative issues and all that. But whereas if we have lean muscle mass, we don't have so much of this pro-inflammatory cytokines, but we have anti-inflammatory cytokines actually, and help you to become okay, what factors that lead to cellular loss? Because cellular loss is one of the main things is our genetics. As I said, we pass on bad genes to our children, and then we have past injury. Please mute whoever is talking, please mute. And then we have our lifestyle, poor diet choices, stress levels are very high. We have so much of environmental toxins, and then we have poor hydration, and our pH of the body is always acidic because we don't have enough plant-based in our diet. So we're going to see what are the causes of free radicals. We have pesticides in the environment, in our food, and then we have chlorinated water. We have a lot of antibiotic even in our food, toxic fumes, preservatives, radiation, EMF radiation. I'm not talking about the ionizing radiation. This one is EMF, like from our electrical equipment, and then fuel emission, and also secondary smoking. So you see, we have pollution everywhere. Air is polluted, water polluted, land polluted, sea, and we also have noise pollution now. So when we used to live in the cave last time, when darkness came, it was all dark, and we all went to sleep very quietly. But now, do we even do that? We don't do that. We have noise everywhere, and we are not going into deep sleep. So our body is not able to repair.
I think.
Can somebody mute, please? Can the person who's talking mute, please?
If they
Jacqueline, please mute your mic.
Thank you.
Thank you.
Okay, we want to look at a new wonder drug. If only the drug companies can get out of it, they will be very, very happy. But the wonder drug is actually like this. Very good, high plant-based food we need to take. And we need to go for our colorful vegetables and fruits and all that. We know that. But why are we not doing it? Actually, we need to look at things not in the old pyramid where we used to have bases, high carbohydrate, and then this is how it used to look, the old pyramid of food that we have to, the guideline for food. But now it is supposed to be like this. So your base is actually, you need to have movement, then you need to have hydration, you can have supplementation, and you have to have a relaxation and all that. Then your base of the food that you eat should be on protein base. Whether you're on animal protein or plant-based protein, you need protein because protein is the building block of our body. And if we don't have protein, our body cannot repair. Then we go on to our fruits and vegetables, and then we go on to our carbohydrates, which we need a bit for energy, but it has to come from the complex carbohydrates, not simple starches, which convert to sugar immediately. So this kind of complex carbohydrates take time to convert, and then you can actually burn up whatever energy there is. And of course, we avoid all the saturated fats and high sugar drinks and carbonated drinks and all that. So this is what we need to follow. So if you look here, we need to take food that is nutrient dense, not calorie dense. So when we talk about nutrient dense, it's high protein, a good protein source, and we have fiber, healthy fats, vitamins, minerals, and antioxidants in our colorful vegetables, nuts, and beans, and things like that. But whereas if we go for the easier version, which is calorie dense, so this kind of food, which is calorie dense, is easily available and is very tempting. When we pass by the shop, you can just pick it up and have a go, especially when you're hungry. So I always say you design your food, your eating habits by design, not by default. Just get hungry, go and pick whatever you want to eat, and this is what we end up eating, the calorie dense foods. And then we have to differentiate the difference between good carbs and bad carbs. So these are the good carbs that we have, and the bad carbs on the other side, as we all know. But once in a while we can indulge, but not every day on every meal, which a lot of us do actually, living on bun or living on pasta or living on crackers and biscuits and things like that, and bread. So we want to look at a good source of protein, whether it is from meat-based or animal-based or plant-based. We need to have good source of protein. And then the fats are also very important, because fat, we always thought fat is bad for you, but we have good fats. Fat is also a very good source of energy. And then it's component for tissue and cells. And then the cell membrane needs fat for exchanging of whatever nutrients that you take. And we also need vitamins for absorption. We have vitamins that can only be absorbed when you have fat. And then we also need fats for our hormones, prostaglandin and all that. We need hormones. And so these fats must come from good sources. And then we can see the thing that can help your body to actually recover is what we call as fasting. But if I use the word fasting, a lot of us get scared. Okay, so I will say it's restricted eating, time eating. Your window of eating has to become smaller so that your body is actually constantly on a like a high peak performance. So you see, you want to reduce inflammation if you do that. So before I go into that, say for example, if you have a kitchen that you're always cooking, no time to clean the kitchen, the kitchen will get so greasy, one of the days you will have a fall. Okay, so this is what happens with our body. We are always putting food in our body. We don't give the body time to actually assimilate what is happening or discard what is happening, and it's working overtime. So we go into inflammation. So by eating restricted time, that means you eat on an 8-hour window or 12-hour window. In between, you just have water or plain drinks. Then you can reduce inflammation. Then you increase your antioxidant enzymes. You increase stem cells, which is called autophagy. There's a Nobel Prize for this one, because when you fast, your body realizes that it needs to clean up. So what it does, it cleans up all the the cells that are not working properly and all that, and it recycles to become new cells. Okay, and then your mitochondrial repairs, that's beyond your DNA, this thing. And then your muscle mass improves because you're burning off your fat. And then also your brain function improves, cognitive function improves. We improve our insulin sensitivity. So when we eat again, we are better able to put the food where it needs to go, rather than being stored up as fat or glycated into our protein glycation and causing a lot of health issues. So you see, when we look, also we need to take care of our joint and muscle health, because this work together. Because if we have lean muscles, then we have very well aligned joints, and because your joints are aligned, your wear and tear becomes better. So this is what we need to look at. Our body system, our skeletal system, and together with our muscle system. So we just need to do very light stretch exercises, very light weight bearing exercises, so that our muscle mass is maintained. Most important is to do movement. We need to move, but we don't need to go and do vigorous exercise, running for a few hours and doing things like that. We don't need to, because in fact, when you do that over exercise, you actually produce more free radicals and damage yourself. As you can see, many times you've heard these people who are peak performing athletes, but they die in the field, or when they die when they're doing the training or whatever, because they have overdone it and too much of free radicals have been produced. So the other one that you need to look at is your gut health, because the gut, a lot of research shows now the gut is actually another part of your heart or another part of your brain. It actually supports very well, because if we don't have gut health, we have problem for immunity. Then we also cannot absorb and also produce more vitamins and all that. And our metabolism goes haywire, and we tend to gain a lot of weight. And then we have inflammation. We should also have inflammation of the guts, which is like irritable bowel, colitis, and all kinds of diseases related to our bowel system. And then we also have neurodegenerative problem as well as neurodevelopmental problems. We have a lot of young children coming with autism nowadays, and the cause is actually pinpoint to the gut, how the gut functions, how healthy the gut is, and how tight your gut is without leaking. So if we have good bacteria, gut bacteria, we have, if you have bad bacteria, we have increased inflammation, quality of life goes down. So if you have good bacteria, our inflammation reduces, our body function becomes better, and our life becomes better, quality of life will be better. So the other part that we need to pay attention to our body is our lungs, because when we get older, is a lung impairment as well, because what happens with our chest wall, the mucillary ducts and all that, it becomes less elastic and it becomes stiff, and then we are not able to expel the mucus or the dampness from our chest and the lungs, and then we get problem because our elastic fibers are cross-linked, and our breathing ducts, the alveoli and all that are enlarged, so our lung function becomes poor. So when we come a little bit of infection, we go to hospital, we pick up more infection, and then we succumb to chest infection because our lungs are not healthy. So we need to actually do some sort of breathing exercises or breath works, which concentrates more on holding your breath and breathing out, not breathing, overly breathing, but actually controlled breathing of breathing out and how you can hold your breath for a while. Okay, so we know that this is the thing that is affecting us: stress, anxiety, and some of us have alcohol issues, some of us have lack of sleep, unhealthy diet, we don't hydrate ourselves, we don't move enough, and on top of that, some of us choose to smoke. So these are the things that are actually damaging our...
That's a 5-minute timer.
5 minutes.
When we look at our immune system, we talk about our immune system, actually we look at our immune system like how we have a dog in the house. So if you have a good dog, the immune system is like having a good guard dog that protects your body against threats. Then sometimes we have a dog that actually is overreacting, hypersensitive disorders. Sometimes the immune system may overreact and attack things that inherently harmful, not harmful. Like when your friend comes, the dog doesn't recognize any barks. So that's where we have hypersensitivity like eczema, asthmatic attack and all that. Then we have immunodeficiency, which the dog is dead actually. Because we have a dog in the house, but the dog is a dead dog. Sometimes the immune system stops working. And then when we have immunodeficiency, we cannot overcome infections, like even chest infection, we can succumb to chest infection or infection of the wound and all that. And then we also have not able to recognize cancer going on in the body. We have full-fledged cancer. Then we also have another thing, which is a bad dog, which just attacks everything, like autoimmune diseases. Sometimes autoimmune diseases is like the dog attacking the owner. So this is how we can actually look at the 4 different scenarios of how our immune system works. So we know aging process, we have cardiovascular issues, we have neurodegenerative issues, we have metabolic issues, we have skeletal issues, musculoskeletal issues, and also immune issues. This is all part of our aging process. But actually, there are 9 things that actually that's going on beyond our cell that is actually slowly killing us. So when we look at it, I will just go through one by one. These are all the hallmarks of aging. Okay, the first one is lack of proteostasis, which means that our protein, when we take food, it changes into amino acids and then it go to peptides, and they must know how to fold and fit in and function properly. So as we get older, we are not able to do that. Function is like degenerated, and so we don't utilize our protein properly for repairing, and we run into health issues. And then we have epigenetic alterations because of our lifestyle. We pass on the expression of genes to our children as well. But you see what happens when we have genes in our body, they need to express at the right time and suppress at the right time. But because there's a lot of changes and confusion because of chemicals and all that, it expresses at the wrong time and suppresses at the wrong time. So we have telomere attrition. It means in our chromosome, the ends of our chromosomes are like shoelaces. So as the cell divides and divides and divides, the shoelaces end becomes shorter. So when it becomes shorter, they are not able to divide. So it is dysfunctional already. So this one is actually our genome, okay? Because of our environmental factor, every day we are bombarded with mutations. So our body must be able to repair the mutations on the spot. If not, the repair gets carried out, and then becomes full-blown diseases because the cells can't function because they don't have the proper raw material to do the work. Then we have cell senescence, which is actually our cells die. But when they die, our body should recognize and get rid of it immediately. But what happens here is our cells are becoming old, and they're sitting there sending wrong messages and wrong signals. And then that is where you have havoc in your body like cancer and things like that. So we have also deregulated nutrient sensing. So when we take food, for example, when we take carbohydrate, the body should know where to send it to the cell and how it's burned off as energy, and then a little bit is stored for emergency use. But if we have improper sensing, it is all sent to wrong places and then is glycated into your other parts of the body. That's how we ended up with having cataracts, we have kidney diseases and nerve problem, neuritis and all that, because it is all gone to the wrong places, causes inflammation, neurodegeneration, and also cardiovascular diseases. So we have altered intercellular communication, because when our cells need to communicate with each other very well. So if we have not ability to communicate, we have problem. Like even in our family, if we can't communicate with our family members, always end up with chaos. So that's what is going on in the body too. So we can have also mitochondrial dysfunction. Mitochondria is the place where it produces energy. And then if you're dysfunctional at that part, you're beyond your cell, then you will have dysfunction and ended up with all these chronic health issues like Parkinson, epilepsy, or whatever, fibromyalgia, a lot of health issues related to dysfunction. And then we also have stem cell exhaustion. So you see, when we are young, our bone marrow is pink and we produce a lot of stem cells. As we get older, our stem cells turn into yellow marrow and we don't produce so much stem cells. So stem cells are produced in the bone marrow. There are two types of stem cells. One is what we call as the hematopoietic, which is actually produces all the blood cells. The other one, what we call as the mesenchymal stem cells, which actually produces all types of, stem cells that can differentiate to all types of cells in the body, organs in the body. Okay, so we remember that when we were a child, when we were born, or when we first started life, we started only with two cells, one from mom and one from dad. And from there, we divided and divided and divided and divided and differentiated to become a human being. So when we have a health issue, do you think it is the right process for us to approach at the cellular level, or go on, put more chemicals in the body and confuse your body further? So this is what's happening. So we're going to look and see how AFC products can make a difference. Okay, basically AFC products are made from salmon ovary peptides. Okay, what is so special about it? Salmon ovary peptides are unique because they're derived from a highly nutrient-dense bioactive source. Salmon ovary, the covering of the salmon fish, the roe, the ovary, has got a lot of amino acids and building blocks. These peptides are particularly rich in growth factors, nucleic acid, which is, I told you, for DNA repair, amino acids, which is the building block, and then making them more potent than any other peptide sources. We have many other peptide sources, plant peptides, soya peptides, and all that. But this peptide is the one that is very functional to the body. Okay, why? This one, salmon ovary peptides, is the ultimate solution for reverse aging and chronic health recovery. I said the word reverse aging, not anti-aging. So we're talking about reverse aging. And it has been happening to many of our friends and for us as well, who've been using this product regularly now. Okay, so the first product we look at is SOP Subarashi, salmon ovary peptide Subarashi. It has got 3 peptides. One is from salmon ovary, the other one is from sardine peptide, and one from fruit flow, which is from tomatoes. And the 3 peptides together with nucleic acid, chondroitin, amino acids, elastin, fish collagen, hyaluronic acid, and L-glutathione, which helps synergistically for the body to recognize what's going on and replace and repair what is needed. So this one, we have 4 patents on this product. The first patent is cell regeneration and production. And the second patent is improved peripheral blood flow. So this is a very important. When we get older, our peripheral blood flow becomes blocked actually. We don't have good peripheral blood flow. So we end up getting sore or wound in our leg and we don't heal. That's where people start having amputation. So we have seen people using this product and supposed to have amputation or supposed to have some intervention done, or the wound that doesn't heal gets healed because we open up the peripheral blood flow. This is your microcirculation, which is very, very important, your microcirculation. And then we have antihypertensive, because most of the time when we go and have a hypertension issue, doctor gives you a medication, not knowing what is the cause of your hypertension. But the hypertension is caused because of your inability for your blood vessels to relax. And this helps to relax. And then we have anti-thrombotic agent, which actually helps your blood to flow freely. Because when we talk about thrombosis means clotting of blood. The blood should only clot when it's exposed to air. That is our safety mechanism so that we don't bleed to death when we have a cut or an injury. But what happens when we clot inside our blood vessels? Then ended up with a stroke, with a heart attack, and even thrombosis in the leg we have because our blood is too thick and is stuck together and too much of toxins inside there. So this is what the 4 patents are. And here we have the European Food Safety Authority, and they have actually, endorsed our product. And then this is the benefits that you can get. It can help you to work with your heart, your blood vessels, your pancreas, kidney, and gives you new stem cells. It helps you to actually improve your brain health, your skin and hair, your joints and bones, and also helps basically your DNA, which is very, very important because we can approach anything at the cell level, at the organ level, at the system level, but we need to actually handle the core, which is the DNA repair beyond our cells. So this product does that. The other product that we have is Utsukushi, which comes with 3 probiotics. They got Lactobacillus acidophilus, Bifidobacterium longum, and also Lactococcus lactis. These are 3 special good probiotics, actually probiotics which actually help your body to recover, your gut to recover, to improve your immune system and all that. And then we also have DNA, salmon DNA extract, fish collagen, seaweed, glutathione, vitamin D3, brown rice extract, black garlic, which is also known for improving our immune function, bromelain, which is also very good for our immune system, cancer especially, vitamin C, grapeseed resveratrol, kiwi fruit extract. Together, this again works synergistically, and with the Subarashi, hand in hand, they do a lot of reversing in the body. Okay, so this one is actually, we talk about the natural killer cells in a while more, and then we have super antioxidants, and it does DNA repair, and the 3 probiotics work together. Okay, why is the natural killer cell important? Because this is part of the immune system that actually recognizes cell changes going on, especially when we have cancer. We all have free radicals. We all have like cancer cells in our body. But if our body is able to take care and like a commando, kill off the enemy on the spot, we don't go into full-blown cancer. But if our immune system, especially our natural killer cells, are naive, and they're not smart to recognize, so we end up having cancer. So even when we have cancer, we go for chemotherapy, which actually damages every cell in the body. But whereas if we increase our natural killer cell, we can really reverse the cancer and come out without any collateral damage, any other damage being damaged. So this is how precisely the Utsukushi can work. Okay. This is Dr. Olaf. He is the the president of the National Naturopathic Association in Europe, and he says Utsukushi is a miracle product. So it's coming from him. It is like you can.
our ladies are crying.
Okay, we have here the patents for Utsukushi. First patent is actually anti-tumor agent. Second is immune activating agent. Therapeutic agent for hepatitis C, is infection protection agent, suppression of tumor growth, and also reduces the side effects of anti-cancer drugs, prevents and treats infection SARS. This is actually chest infections, protect against toxicity and reactive oxygen, and also is a toxin reducer. It actually works in your liver to detox.
When cameras on.
Okay, the third product that we have is actually what we call as a Hikari, which is a triple vegan peptide. This is a vegan product which comes from marigold, spearmint, mango leaf peptide. So this is the product which has got a lot of berries inside. So together with the 3 peptides, we got acerola cherry, blueberry, cherry extract, lingonberry, L-cysteine, blackcurrant, inulin, and strawberry. So this works synergistically. And then we have also got 5 patents for that. Improves visual performance of eye health, improves brain and memory, and then protects eye from blue light, enhances brain function and activity. And then the most important pattern number 5, it enhances neurogenesis level, which means that it can actually give you new brain cells, help you to produce more new brain cells. So the function that can help it is attention problem, attention deficit hyperactive children or adults can take that, autism, speech delay, sensory impairment, Alzheimer's, dementia, nearsightedness and farsightedness, and also eye inflammation, dry eyes, and cataract symptoms can help with all this.
That's a big bed.
Can the person please mute?
Yes.
Thank you.
And it's a full
And
bed.
then we need to look at a holistic approach. We need to have movement and relaxation, rest and sleep. And then we need to have we need to have community. We need to socialize with people. Because when you look at people in the blue zone, they are very healthy because they have very good community support. So when we want to be healthy and live, having a long life of health and all that, we need to have a lot of friends and we need to socialize in a healthy way. And we also need to have a purpose-driven life. We need to have a big why in our lives. And we always have to be mindful of what we are doing. And of course, spirituality helps for us to become more balanced. So when we look at it, we always agree prevention is better than cure. Then we want to always look younger for our age. And then we want to feel good and vibrant. So we cannot say like tomorrow, if I invite my friends to come, one of my friends might tell me, if we go to 2 places, I will feel tired. They already started feeling tired for tomorrow. But we don't need to be. We need to have abundance of energy for the whole day. And then we also have to be pain-free and flexibility of joints. I don't know, people have accepted the fact that when we get old, we must have joint problem, we must have immobility problem. And then they stop moving. But actually, we need to keep moving. Then our joints become healthy. We need to be better. And then we have clarity of life till the end. Because some people already at 40 and 50 having memory problem. By the time they are 60, they cannot remember who their family members are. They cannot remember the way back. And sometimes they go shopping, they get lost and they get panic and somebody has to take them to the police station to find their way home. Then we also want to be wealthy. What I mean wealthy is that we are not going to spend our life saving when we are older to pay for medical bills. We want to enjoy ourselves and indulge in things, go for holidays and be healthy, not spending on medical bills. Okay. 70% of longevity is related to lifestyle and therefore we can control it. 30% is genetic, it can be reduced. And our products, Subarashi, can help you to reduce the genetic issues as well. So instead of trying to eliminate disease or compensate for the dysfunction of an organ, we should do things that support the natural healing system of the body. It opens a whole new horizon in the field of health. Instead of eliminating problem, we can prevent the problem and support the ability of the body to heal itself. The potential here in this area of health and healing is world-changing. So Subarashi, Utsukushi, and Hikari we can do a movement to change a lot of people, actually, a lot of suffering in the world. We do not have to accept the common belief that degenerative diseases is just a normal part of old age, getting old. The true normal state of health for senior is healthy and active, not disease and drugged. So which state do you really want to be living in? Think about this. After retirement at age 65, you could live for another 30 years. And if you take care of your health and nutrition, that's all. Lifestyle, nutrition, you can change a lot of things. Okay. Dr. Linus Pauling, he is the winner of 2 Nobel Prizes. He said the human body, which is receiving proper nutrition, is quite capable of dealing with almost any disease, from degenerative diseases to those caused by bacteria or even viral infection. If we have a good immune system, whatever infection we get, we can overcome it. Okay, so we have done this already. Okay. Disclaimer, this information provided here is for general information purposes. It's not considered as substitute for professional medical advice, diagnosis, or treatment. Always seek medical advice and go to your qualified healthcare provider. So, only thing that you need to do is try it for yourself. Okay. But before I end, I just want to give you a thought. When we get old, do we want to be like this or do we want to be like this? The choice is yours. Thank you. Alfredo, are you there?
Yeah, Pat, thank you very much. Okay, before we proceed for the Q&A, all right, we like Patricia to stay on also, right? For to answer some quick Q&As. So before that, let me just share with you the testimonials that we have. Okay, let me reclaim the host. Then I'll share my screen. Give me a minute. Exit full screen. Oh gosh. Can you see my slide, Pat?
Yes, Alfred.
Okay.
Put it on
Hello.
slideshow.
Okay. So before I show the testimonials, let me just put a testimony disclaimer here. The result obtained from AFC products by each individual may vary depending how it was used for the individual's physiological attributes and the health condition of each individual product user. Okay. Now, the first testimony that which got me attracted to join AFC is this. This is a fantastic testimony that I've never seen any other supplements that in the market that can help. This is a case of a guy who's residing in the US. He's actually an Indonesian. He suffered multiple chronic diseases, including kidney failure. Now, what happened was in late 2019, he had lupus. Okay, and his lupus attacked both the kidneys, and he fainted, and he was brought to the hospital, and the diagnosis came out that he was given 3 months to live. All right, and no choice, he has to go for kidney transplant immediately. So he was on dialysis for 4 times a week. That's amazing, I mean, I've never, people usually will go for 3 times a week, but this guy went for 4 times a week. Okay. So while waiting for the donor, the right kidney, so he was on dialysis 4 times a week. He started taking Utsukushi and Subarashi, these 2 products only. All right. The first 7 months, the first 5 months, he only see results like having better strength. That's all. And changes in the skin. Normally dialysis patients, you can see the lips and the skin are all affected, right? So he noticed that the changes in the skin, but nothing much on the creatinine level. But on the 8 months onwards, his creatinine dropped and GFR also increases. So after that, the test, he was reduced. His dialysis was reduced from 4 to 3. This one is after the 8 months, okay? And he continued on taking the products. And then after 1 year, it reduced to 2. Second, 1.5 years later, reduced to 1. And finally, on the second year, he was asked to stop dialysis. That's amazing. The kidney regrew. Amazing. So there were 8 specialists who were attending this guy, and they were so surprised that he's still alive. And today, if you look at his picture, I don't have his picture right now. He looks very much younger, and he's very much alive. Okay, from a kidney failed, kidney failed, given 3 months to live. Today he's really alive and looks younger. Okay, so it's truly amazing this product, what these products can help to all those people who are suffering from kidney failure as well. Now let me go to the other one. Now this is another autoimmune disorder. It's vitiligo. This is a police officer in Indonesia. Normally, these kind of cases, there is no treatment for this. All right. The most the doctors can do is to give them treatment of doses and doses of steroids. That's all, to suppress, but it doesn't help. But this guy taking Subarashi and Usukushi, look at that, and it doesn't, it takes him for a while also, right? So that's why our products here, even it can show fast result, but to those people who started on Subarashi and Usukushi or Hikari, don't expect to see the results in days or months. The products will work in your body. As long as you continuously taking it, you will see results. Okay, so this one, it takes him about 5 years to see. This is amazing. This one is a diabetic foot ulcer. You can see the before and after, right? Suffered from a chronic diabetes, and then look at the wound is open. You can see the skin, you can see the bone, okay, right through. There's a hole. But after taking Subarashi, look at this. He says konsumsi satu packet, means he has taken one package of diamond. That means 12 boxes in the last for a period of 3 to 6 months. Okay, this is the condition. The situation after that, before and after taking one package of diamond. It's truly amazing that it can regenerate the new cells and having new cells. And look at that, after it regrew, and it gets better. And same to this one, same like this one. Okay, after taking Subarashi and Usukushi, after 3 months, this one is 3 months plus. Normally, doctors will just amputate this, but in Indonesia, they want to fight. So most of them will go, those who tried AFC products, they find very beneficial. Okay. This one is another case from a really bone is also blackened, and after 3 months or so, you can see that the tissue are growing, and even the bone is now turning to white. That means it's active, the growing. Autoimmune disorder, this is psoriasis. You can see it's also effective, taking Subarashi and Usukushi. If you look at the other side, on the right hand side, it's burn hand testimony. This one is a burn hand testimony, consuming only 1 sachet of Subarashi, and on the 4th day you can see that it is improved, just 4 days later. This is about a guy who has liver cancer. Okay, and look at the 0 week when he first started Subarashi and Usukushi, taking 1 Subarashi and 1 Usukushi a day. All right, and look at the changes on the 2 weeks, the 3rd week, 2nd month. On the 3 months period, he's full remission. That's amazing, isn't it? Look at the face, even he looks younger. And below, the same thing. After taking a month, you can see the aging process. It's improved. You can see the skin is glowing just after a month. On the below right side, that's about 3 weeks. You can see the differences. This is on breast cancer. open wound, totally rotten. And this is the before. Look at that on the right side. Third day after taking Utsukushi and Subarashi, you can see it's drying up. 7 days below left. And amazingly, after 11 days, totally dried up. Now, this is super amazing. You will not see any products that can help to dry it up that fast. Yeah. But in this case, it really help this lady, just by on the 11th day, you can see that everything is dried up. Yeah. This is another case of PNC, pharyngeal nasal carcinoma, okay, mouth cancer. Look at his tongue. He even lost weight until 40 kg. He's actually a medical practitioner, TCM, traditional Chinese medicine. And you can see from before, the picture before, after 1 month, and after 3 months, consuming only Subarashi and Utsukushi once a day. I mean, one Subarashi in the morning and one Utsukushi in the evening for 3 months. And this is the medical report that his cancer really, he's free from cancer. Yeah, today is the most active distributor who is a walking testimony. He doesn't practice anymore. He's just sharing and spreading AFC to all his friends and family members. This is on a case of a person who got thyroid problem. Yeah. Imagine taking just Utsukushi and Subarashi for 14 days. It's flattened. Yeah. It's so fast. Yes,
Yeah.
14 days. 14 days is amazing.
Oh, I didn't mean to come in. How you doing?
Venetia, you're on us. Venetia, can you mute yourself first?
Okay.
Let me finish. All right. This is a tumor on the brain after taking Utsukushi and Subarashi. Yeah. After a few months, you can see even the hair is growing now. The tumor is gone. This one is about a boy, about 10 years old boy who had one of the left eye has cancer, and this cancer has spread to the brain. Yeah. Usually the doctor will just take off the eyeball and just those affected area, the eyeball will be taken off. But taking the product AFC, Subarashi and Utsukushi, yeah, the boy recovered. Even if you see the right side here, look at that, the cancer is gone, and he can see light now. Okay, who knows if he continues taking, he will be able to see. We don't know. Okay, but the most important thing is the cancer has been stopped, and this boy has recovered. Yeah, so hopefully he can see one day. This is about the tumor all above the tongue. Yeah, before and after. You can see. This is another psoriasis case of before and after. This is a full-blown psoriasis boy. Yeah, after taking Subarashi and Utsukushi, look at that. Yeah. This is another one. The tumor just almost covered the whole face. Yeah. You know how amazing it is. You know, the boy has a better future now. Even those this kind of humongous size can be gone. Yeah, after taking Subarashi and Utsukushi. All right, Hikari now. Hikari. This is a Hikari's testimony. Can see this is cataract. Yeah, and another one is dementia. Okay, so Hikari is also very good for people having dementia, Parkinson. Yeah, and this is about a boy who was not able to focus. Look at that. After taking Hikari, he is able to do the dancing lessons now. Yeah, before he will just refuse to join, but after taking hickory, he's now able to join and becoming more participative. Yeah. This one another infection of the eye, just taking 4 sachets per day of Subarashi Utsu, then added 4 hickory. The swelling reduces. Yeah. For cerebral palsy as well, you can help them. Yeah. Okay. So these are all the certificates that we have. Organic certification, free from hormones, yeah, free from nuclear radiation. Okay. So and our products are also registered in MIMS. MIMS in Indonesia is like the PDR, Physician Desk Reference Book in the US, where all the supplements and the medicine are, you know, in the book, in this book, and normally doctors will use it for reference. So our 3 products are inside MIMS. That's the reason why today we have thousands and thousands of doctors who are doing AFC with us. Yeah. And they're prescribing the AFC products to their patients. Okay. So I'm done with my the testimonials. Let me just pause here. Okay, I'm opening up for Q&A. Pat, are you there?
Yes, I'm still here.
Okay. So, guys, do you have any questions?
I see questions on the chat.
Okay.
Oh.
From Jacqueline. Huh? I have a friend suffers from norovirus. What kind of FC can give to her? Now, when we talk about viruses, the only product that is very effective in is Utsukushi. Yeah. Any infection, we always give Utsukushi. Utsukushi, yeah. So you depending on the severity, if it's very serious, you can increase the doses. Yeah. But after a week, you may combine it with Subarashi. Yeah. To fight the infection, you need Utsukushi. And for rebuilding and regeneration, you need Subarashi later on. Okay. And the time spent, I mean, the period of healing, it depends on individuals. Some people will have response very fast, and some people are slow. But don't worry, even there are people who are even 2 years. You can see even the kidney was renewed, right, for 2 years. So it works. It helps in the regeneration of cells. Okay, Jack. You have another question. I have friend who suffers immune system, dry eyes, high in cholesterol, cannot sleep well. Kidney 60% working, heart problem, water inside. Her face not good, fat liver. And I recommended her to take SOP and Usukushi. Yes, correct. Yeah. You may start with 1 each in the morning, or one Subarashi in the morning, 1 evening Usukushi, or you can take it higher, depending on the affordability of the patient now. Okay, you can take as much as you can. Yeah, so that's the recommended products that for these patients, Jack. Okay, so continue taking it for 3 months to 6 months. Yeah. Okay, any other questions? You can unmute yourself and okay, Kumaran. Yes, sir.
Alfredo,
Yes, sir.
your first testimonial, the one from the US, kidney failure.
Yeah.
Okay, how many packets sachets he was taking? I mean, how many Subarashi, how many Utsukushi?
He started with SOP, Subarashi, and Usukushi.
Okay,
Okay.
yeah. Per day, how many?
He's taking 1 each. You know, one. I have to reconfirm because I know that he was taking both. he went from two each, I think, the most. But for a period of but he was taking it continuously, okay, for 2 years until today. He's taking it. Yeah.
Okay. Okay. That means by just taking one ushi and one is also can save him, right?
Yeah. Depending on the person, each individual, right, Kumaran. I have a friend here, who I've seen taking just the product. He was only taking one subarashi. That's because that's what he can afford, you know. And his creatinine level was 648, and he doesn't want to go for his creatinine level. 648 is very high. Those people with 300 is already been recommended to do dialysis, but he has been evading, scared because he doesn't want to go dialysis. So his reading went up to 648. So he asked me, he can only afford one box if you want to try. So he took one sachet a day. After 28 days, because one box is 28 sachets, right? So after the 28 days, he went for checkup, his blood test, his creatinine level dropped to 300. And he took another box. On the second month, it went down, and he never gone to dialysis. Okay, so that's truly amazing. We can help people with this.
Okay, all right. Thank you, thank you, thank you, bro.
But one thing we always tell people, don't go back to the lifestyle which got them into the sickness. Yeah, so they have to change their lifestyle as well. Yeah, because the eating habits which made them sick, so they have to change that after taking the products. Yeah. Okay.
Okay, thank you, bro.
Any other questions? I don't see
Yeah, I
any.
have a question. Okay, so there's this girl that has sugar diabetes 1, and she's 30 years old, and she's had it since she was 18. If she gets on a large amount of these products, is it possible to reverse that?
What does she have, Janet? I didn't hear that.
Diabetes 1.
Okay. Type 1.
And
Okay.
She's 30
We
years
have
old, and she got it when she was 18 years old.
okay. We have cases here on type 1 diabetes, which are dependent on insulin. Is she on insulin now?
Yes.
Okay.
She wears it on her arm. Sometimes
Okay.
she wears one patch, and then another time she wears 2, so it continually releases when she needs it.
Okay. So this is what she can do. She can start with SOP in the morning and Utsukushi in the evening. She may start one sachet a day, and we may be able to increase it if she can afford. Why not? Take higher doses, but minimum one subarashi morning and one Utsukushi in the evening. Yeah, we have cases here that very severe. This guy was on 2 doses of insulin jab a day.
Yeah.
And
Yeah.
so I started him with 2 morning and 2 evening combined. One utsu, one subarashi morning, and then evening one subarashi and one utsu.
Yeah.
And on the 5th day, amazingly, the reading from 23 readings went down to 6 and below. Even the doctors were surprised and thinking that, why a sudden drop. But this guy has been taking these products for now 8 months now. He's no more on insulin. Okay, he's just taking subarashi and Utsukushi.
And he
Okay.
was a diabetic 1.
Yeah, he's type 1, insulin dependent.
And how old was he?
Oh, he's 50.
Wow.
He's 50 plus. Yeah. He's 50 plus. A friend of mine. It's amazing, Janet. It's truly amazing. So,
Okay, so
depending on individuals again, you can try one each, okay, a day, and see how it goes. But minimum, she must take it for 3 months because you need the body to heal, right? So
yeah.
We are not taking medicine here. We are just helping the body to function back. It was before. So it has to take. She has to take 3 months to 6 months. Yeah. If the result shows it earlier, it's a bonus for her.
Okay, so I got another guy. He's about 35 years old, and he has on the left side of the leg these veins that pop out, but they're not purple. They look like huge worms, though, but they don't have any color in it. And his whole leg from his knee down is just all these huge veins. So, I mean, I used to have large veins and wrap them up, with ace bandages when I was pregnant because I had 8 children, and I'd have to sit in wheelchairs. They were really bad. I mean, they've gone now, but his are just like huge with no purple or blue in it. It's just the color of his leg, and they just like huge, like the size of pencils bulging out. And he said he doesn't have pain.
You're talking about varicose, is it?
Veins, yeah, but they're the width of a pencil, and it just goes down his whole entire leg. Like, they sent a picture of it. It was so gross. From the knee down, he doesn't have pain, and it doesn't have any color, like no purple like veins usually have. It just looks like worms crawling all up his leg, huge thick worms. I've never seen anything like this before. I don't know what.
Okay, Pat, you are there? Are you there, Pat? You want to handle this?
Yeah.
I-
Yeah. Actually, Subarashi especially can help. But you see, we know our body has got its priority. When we start taking anything, the body sends the repair to the most important part first. So as far as the blood vessels in the leg is concerned, it will not happen straight away. Over time, he will see difference. And he has got to take like at least 2 Subarashi per day over a period of 6 months to see them shrink and get back stronger.
Is that the blue one or the red one?
No, the blue one.
The blue one. Okay, so
especially the blue one.
that's a circulation, right?
Yes. So it will help to strengthen the blood vessel, be it the artery or the vein. Usually it's the vein actually that is engorged, and then it will help to actually have the lining and all that to strengthen up, to repair, to reverse what's happening. But it takes a lot of time because the body will send it to where it's priority, which goes to the liver and the heart and other places first rather than going down to the legs and the veins, But veins, it could be much faster also. So maybe he should take it for 6 months. At least 2 Subarashi per day. 1 in the morning.
Yeah. Because I was thinking that's tied into the liver and the heart. And that's exactly what you just said.
Yeah.
All right. Perfect. Thank you so much.
Thank you.
I have a question about Hashimoto's. Do you guys have experience with people with Hashimoto's?
Can you say it slowly, please, Angela?
Hashimoto's. What is your experience with dealing with Hashimoto's? Is an autoimmune that attacks the thyroid.
Okay, anything to do with autoimmune? All right, I haven't heard about this case that you're saying now, but if it's got to do with autoimmune, then the products that can handle this is taking Subarashi and Utsukushi. Okay, now if it's to handle autoimmune disorder, we recommend the Subarashi more dominant on the first 2 weeks. That means if you are taking, example, okay, if you're taking 4 sachets, 3 has to be Subarashi and 1 Utsukushi. And after the second week, the 3rd week onwards, you can combine it both, Utsukushi and Subarashi. Okay, so you can start.
I want to add something.
Wait, Rudy, let me just handle Angela's question first, okay? So Angela, this patient can this person can start taking Subarashi in the morning, okay, maybe 2, and then 1 utsukushi in the evening. Okay, repeat that for 2 weeks. On the 3rd week, then you can do 2, or even 1. Yeah.
Okay, thank you.
Yep.
Let me add to what you said about thyroid. About the
okay.
thyroid. We had somebody with cancer, okay? And not just that he was taking the Uchikushi and Subarachi, but added taking 3 times a day of the Hikari, and then the big C is gone.
Wow.
Thyroid.
Woo!
So
That's
the
amazing.
issue of just that, it's adding that. Well, it's like myself, the issue that I have is been diabetic, type 2 diabetic for 25 years. And my drugs intake used to be over $5,000 to $6,000 a month.
Ooh.
And I went through the quadruple bypass. And I was told that my leaky valve, eventually gonna need to have surgery. Leaky valve is gone. So these are making people wonder, because my A1C for type 2 diabetes supposed to be is at 5.8. And the doctor said, you're no longer diabetic.
Wow. Amazing.
So, a lot of the testimonies. Okay.
Mm.
And there's more to that, because like Alfredo, you know that I've been taking it now for over a year, nonstop. That even my kidney function went upward. I was already down in the 30s. I'm back up to 50, 57. And that's a huge improvement, because that's at my age, 55 is normal, they said. Okay. And maybe some of you now know I'm not a young man.
Yeah. Yeah. Same age as a Colonel Burger. Yeah. And that's great.
So
Man.
there's a lot of testimonial.
Yep.
We're getting a lot of testimonial already in the US, Alfredo.
Yeah, wonderful. Great, man. Yeah, again, there's no fast rule on taking the products. You know, if you can afford, take all 3, you know, 1 each, 2 times a day or whatever, you know, because what we want is to be healthy. And what Patricia was sharing is now, health span is better than lifespan, right? Yeah, we want to be healthy after 60 to 100 years of age if we can, you know, why not? So health span is more important. So take all 3 if can. But specifically, if you have condition, very severe condition on the brain, say like dementia, then you focus on hikari with utsukushi. Okay, eventually you have to take also subarashi, you know. So first few weeks you try the 2, and then 3rd week onwards you combine with subarashi for dementia and Parkinson. Yeah. Specifically for autism, you can just start with hikari. We see a lot of children seeing results very fast, like the video that we have shown, a lady from Australia who had glaucoma, just taking hikari twice a day. On the 3rd week, her doctor already mentioned that her glaucoma is diminishing, and the pressure, everything went down. Yeah, 3 weeks. That's amazing.
Alfredo, question.
Yes.
This is being recorded and I missed half of Patricia's presentation, which the half that I got was amazing.
Yeah.
Is there a way you can send it to me so I can listen to the full presentation?
Okay. Are you in the chat group, Angela? Where are you based?
I'm on Zoom. I'm in the chat. So you want me to put my email or?
Do you have WhatsApp?
I do have WhatsApp.
Okay. Maybe you can type your number so I can take it off.
Okay,
You're
let
not-
me,
You're not
Oh.
in the chat group yet, huh? Are you in the US?
I'm in the US. Okay, I'm gonna send you a message. I think I have it here, so I'll send you my email.
Okay.
Thank you.
And your phone number, please, yeah?
Okay.
Okay, let me read the chat box again. Lally, I have an irregular heartbeat. I've been taking one each Subarashi, Utsukushi, and Hikari in the morning. Should I change way I'm taking them? Okay. If Lally, if you're talking about heart, okay, cardiovascular, you should be focusing on Subarashi and Utsukushi, these two. Okay. You may add Hikari later on. Yeah. Because Hikari also will improve your brain function. Yeah. But we want to focus on your irregular heartbeat. Yeah. Your palpitation or whatever. So Subarashi will be more dominant. You can take one morning, one evening. Okay. 2 sachets a day of Subarashi and 1 Utsukushi. Then after a week, then you can add with Hikari if you want to.
Just to add on that one, Alfredo, in Canada, we have someone, an 8-year-old with heart congenitive, and goes into hospital 2 to 3 times a year, and was taking only 1 Subarashi, 1 Utsukushi, and within 90 days, the doctors can't find anything or indication of heart congenitive.
Wow. How old is she? How old is the girl?
8 years old.
Wow. Okay. So how's she doing now?
And that's Harvey's. That's Harvey's daughter.
Oh, really? Wow. Okay.
Okay.
He just called me up.
The testimonial will be coming out soon.
That's great, man. If you can, Rudy, get your team to compile all these testimonials and put in the slides, yeah, and share it. Hopefully, we will have one presenter from your side coming up soon. Eh?
Right,
man. Good. Okay, let me see. Ellen, 81 lady with ischemic stroke. October 22nd occur with right hand and leg. How many sachets? Ischemic stroke. Another case of a heart problem here. Heart and blood vessels. You may take SOP from 1 each morning and 1 Utsukushi evening, or even you can increase it to 2 or 3, no problem. Ellen, yeah. If the person can afford, you can take 2 a day, 2 each, and you may add up.
Alfredo, remind before meals.
Yeah. Yes.
Okay. Much more powerful before meals.
Correct. Subarashi, you may take before meal. Utsukushi, you can take before and after, no problem. Yeah. Hikari as well, you take early before food. The best will be empty stomach. Yeah, and put it under the tongue. Yeah, for the 81-year-old lady, you can start with SOP 1 Utsukushi evening, and probably later on you can add up with Hikari because she's 81. She needs to have she needs to have her memory strengthened, boosted up, so Hikari can help that. Yeah.
Alfred, can I leave the Zoom?
Yeah, I think we're almost done, Pat. If you want to leave now, it's okay. I can wrap it up.
Okay, thank you.
Okay, thank you, Pat. Yeah, so thank you, but she's using Ryle's tube. You mean okay, she's on the tube. You can mix it. Yes, Ellen, you can mix it in her milk or in any juice or liquid that she's taking. Yeah, you can. You can take SOP, say 1 hour after milk. Yeah, you can mix. No problem. Okay. Any other questions before before I wrap it off? By the way, if just I have just quick announcement here. Let me see if there are no questions. Any other questions, Rudy, on your side?
Sir, I have
No.
question.
Okay, yes. Who's that?
Jacqueline, sir.
From Hong Kong.
Yeah.
Yes,
Okay,
ma'am.
because I have a friend who suffers from norovirus. So what kind of AFC product can give to her?
Anything viral, you have to give Utsukushi. Yeah. If you know Utsukushi, if you have seen the presentation just now, it has 8 patterns. Yeah. Number one is when you talk about immunity, that is the product that increases the immunity, the immune cells in the body. All the immune cells in the body will be activated. So Utsukushi is the best to fight viral infection. Anything
Okay.
viral, bacterial, even parasitic, or even cancer. Yeah.
How about the with those diabetes and mental health problem?
Okay, diabetes, straight away you know that you have to give subarashi. Mental, you have to add hickory. Okay.
Okay. So how many
You can start
pieces
with
of
one each pwede na yun. Yeah. One each
okay.
should be all right.
Hello.
And
Okay.
then last one question.
Yes.
And because
Pero that depends on the severity.
Correct.
That
Yeah.
depends on the severity.
Yeah.
okay, and then I have one question more. And then because we have a friend who uses the AFC product, but every time she told us that every time she take because she take maybe 2 otsukushi or 1 subsubarashi and then 1 hickory every time, and then every time she took these products feels like a stomach ache, something like that, and then she stops using it.
Okay. Probably that's why it's very important to take subarashi and hickory before meals. Okay. So if she has discomfort, I mean stomach discomfort, maybe take after food. You know, you can do that. There's no fast rule. The only thing is the absorption rate will be better if it's empty stomach. But because this person is having bowel problems, I mean discomfort, she may take after food. You can suggest that probably after 45 minutes after food, you can take. Yeah,
Hello.
check. You try that.
Okay.
Yeah, and take more liquid water.
Okay, so there's it's not about the number of AFC product
No.
she take every
Don't worry about that. These are all food. The more you take, the more it's like you're taking a lot of food. Yeah, it's just food only. Okay, there's no. It's not chemical. It doesn't give any reaction or other side effects. No worry.
Okay, thank you, sir.
Take the time the difference. If it's causing stomach upset, take after food. Yeah.
Okay, thank you, sir.
Okay. Welcome. Okay.
Okay,
So
Alfredo. Alfredo,
Janet.
I got Morgan on the line. She's the one with the sugar diabetes. She's 30 years old, and she wants to hear what you said.
What's the name again?
Hi there. I'm
Hi.
Morgan.
Morgan. Yeah. Hi, Morgan. Good morning. Good evening.
Good morning.
Okay. Yeah. I was sharing with Janet just now that I had a friend, a personal friend of mine who was on insulin twice a day. You know, and he has been taking this for years, and unfortunately, one of his toes got amputated, right? So because of the ulcer that has been cost him, so he lost one toe, and he was on insulin. he's a diabetic guy, very chronic. So when I got to know about his condition, his toe was already amputated, or already cut severed. And then when I started him off with Subarashi, 2 sachets and 2 usukushi on the first day, he was taking it 4 days in a row, and on the 5th day, his sugar level just dropped from 23 to below 6. And his doctors and all those the nurses were all surprised, scared that that he may have experiencing hypo, you know.
Mm-hmm.
So he continued because he doesn't feel anything. He doesn't have jittery feelings. He doesn't have any shake. He doesn't shake. He's feverish. This is normal. So he
But
continued. He
so
continued.
he's off. He's off
Yeah.
all medication.
Yeah. After no, the insulin was stopped because he cannot talk anymore because when it went down, so he was stopped. But he was still on metformin. Okay. So he was taking that. So continuously taking Subarashi and Usukushi for 3 months, and now it's already the 8th month. He's off the insulin totally, and his reading now is very controlled, within about 5 to 6.
And did he have type 1 or type 2?
I think he started with type 2, if I'm not mistaken.
Okay.
Yeah.
Yeah, I have
We have-
type 1.
Yeah, I know. We have you can do that, Morgan. You just take that continuously 3 to 6 months. Yeah. We have cases in Indonesia who are type 1 diabetes as well. Yeah.
Uh-huh.
And it helped them. I'll try to dig out the testimonial on the Indonesian person, and I will send it to Janet, and Janet can send to you. Will that be okay?
But
Yeah.
the question
that'll
is,
be great.
but here's the thing. The question is, has any of these people sugar diabetes 1 gotten
Yes.
healed?
Yes.
And
We
they're
have.
off the insulin. They're off the insulin.
Yes, we have, Janet. I will send you one. Okay. That case
Okay.
just now I was telling you was a friend of mine. I was just sharing.
Okay.
Yeah.
Okay. All right.
I will send
Okay,
to you.
perfect. All
Yeah.
right. Thank you.
Thank you, Morgan. Bye.
Thank you.
Okay. All right. Anything else? Otherwise,
Hello? Hello?
yes, Venetia. Yeah,
Hi, how are you?
I'm good.
I'm still, can I get in touch with the ladies that I can order hickory? I need to order the product because my glaucoma is
Where are you
really
based again? Where you
United
based?
States
I know.
in
Which
Missouri,
Missouri.
Missouri.
Maybe
Yes.
Rudy. If you're still there, Rudy, maybe you can talk to
Oh,
her,
yeah.
Rudy.
Yeah,
Yeah.
I do have some hickory if you need some.
Yeah.
And I had somebody with they were gonna have surgery for glaucoma, and after taking for 60 days the hikari 3 times a day, went in and ready for they already scheduled for the surgery, and the doctor canceled the surgery. So yes,
Well, I've had all the
powerful.
surgeries. Yeah, I've had all the surgeries, and then on my good eye, that I could see something. Our pole hit it. My bedpost fell down on me and hit me in my good eye. And I've had surgery again, so and it's worse. So I need the hickory bad. I need the other 2 as well, but I
So
need
I'm
the
on
hickory bad.
WhatsApp, so you could. Okay, so go ahead and send me your
See, I
info,
can't-
and I'll call you back.
I don't know how to
on
get on. No, and I can't see now. I can't even dial my phone. I depend off of Google. My site is such that I can't even dial my phone.
Okay,
So I'm
maybe
wondering.
Venetia, maybe you can read out. Why don't you read out the number to Rudy? Read out your phone number. If you can't type, read out.
Oh, yeah.
No, and
Yeah.
I'll call you right. I'll call you right away. Go ahead. Give it to me.
Okay, it is 314 707-6468. I'm on that phone now, so if you call me, I really appreciate it, Rudy. I just believe that can you go too far where you can't see any results
No.
in taking? Okay.
It's well. Let me go. I'll go over it with you after the meeting here. Okay?
It sounds good. Thank you.
Yeah. Okay. By the way, for the benefit of everyone in the US, actually Rudy is our state stockist. Okay. But he's based in California, so anyone can get the products from him. Actually.
Okay.
Okay. Any more questions? All right. So if there's none, I'd just like to thank everybody for joining in. I hope you have learned something here, the sharing and everything, especially from Pat's. She did a wonderful job. We hope that she can continue be with us in the future, because today our good friend Dr. Albert was unable to do the Zoom because he's down with a sore throat. He can't even speak. That's what he told me. Yeah. So anyway, we will have this every 2 weeks, so we'll see you guys again in the next 2 weeks times. If there are speakers who would like to join us and present, we can have it weekly, but for now we reserve it twice a month. Okay. So thank you, everyone.
We'll return, Opero. It should return back to once a week. Every other week is about the product. The following week's about business. But until we sometimes next month we'll be able to do that. Okay.
Okay. All right. That's good. We're hoping that your leaders will come in and start presenting too. All right. We need a white guy to
Yes,
to
they
speak
will.
there. All right. Okay then. Thank you.
Okay. Thank you.
All right.
Okay then. Thank you.
Thank you, guys.
Okay. Good night. Thank you.
Good night.
Bye bye.
Good night.